Welcome to the AI Ireland podcast, your window into the world of AI innovation on the island of Ireland. Join us as we explore how AI is harnessed to tackle both business and societal challenges, revealing the cutting-edge solutions emerging from this vibrant AI community. Don't forget to subscribe for the latest updates and insights in the world of AI. Hello everybody, it is Mark Kelly here. I hope you're doing really well. And I'm absolutely delighted to say we've got Dr. John Sheehan on our podcast today. I got to meet Dr. John a while back at the RCSI AI innovation event that happened, a day event, which was truly fantastic event. And I was delighted to get him onto the podcast. He's going to be sharing some of his insights. To give you Dr. John's proper title, he's Clinical Director at Medical Diagnostics and also Consultant Radiologist at Blackrock Health. But as we will find out from today's episode, John is working in a variety of different streams in the world of healthcare, and he brings a breadth of experience to that too. John, thanks very much for joining us on the show.
Thank you, Mark. It's a pleasure to be here and to discuss the transformative potential of AI in healthcare.
So when you did your speech presentation on RCSI, I think it was back in May now, what I was really inspired about was you wore different hats as a patient, as a practitioner, as a radiologist, working in the world of startups. You've also involved in the AIM Summit, where you're actually bringing different people together in Ireland, and then you've got a US strand to that as well. So you're wearing multiple hats rather than kind of coming at it from maybe one specific angle. Tell us a little about your journey into this and how you kind of came into this world of AI and healthcare, because I think that's good context and background.
Sure. Well, I guess like everything, things started a long time ago. So my journey began with my uncle, Jimmy Sheehan, who's a orthopedic surgeon who's now retired. And he exposed me to a world of medicine from a very young age. I worked in the hospital that he set up, which was initially Blackrock Clinic. And I started working at the age of 15, doing really everything from sweeping the floors to observing him operate, and Maurice Nelligan doing open heart surgery. And this really gave me a very holistic understanding of the hospital ecosystem and sparked my interest in medicine. And I also, during my time, worked there within the IT department and actually looked at a paperless system, believe it or not, 25 years ago, and various other strands within the hospital. After completing my training in surgery and radiology at RCSI, I went to Northwestern Memorial Hospital in Chicago, where I gained exposure to cutting-edge medical practice in the States. The time I spent in Chicago was pivotal. It really broadened my perspective on healthcare, particularly on how technology can be harnessed to, improve healthcare for patients. And when I returned to Ireland, I joined the Blackrock Health group, where I've been since then. I've been able to integrate my passion for technology, particularly recently AI, within my clinical practice.
What a interesting time to be a 15-year-old, where the majority of us are working in SPAR or ESO as it was. You're sweeping the floor and getting to see what's going on under the hood of a healthcare provider, from surgeries to it's truly incredible. I can only imagine what that was like to be actually doing that type of experience, and how grounded you'd be in I suppose, an empathy, because you're kind of seeing all the different hats, which I think is kind of wonderful. So you really kind of get that appreciation. And I also kind of agree, when you go somewhere else, you kind of be outside of your comfort zone. So you have to kind of immerse yourself. So I can only imagine that was like in Northwestern, and you came back and become a practitioner. So tell me a little bit about your work in radiology and how you've been able to use AI to probably positively impact the customer experience, and also saving you time, being more efficient, I'm sure.
Yeah, so radiology is an interesting space, given the fact that radiology probably accounts for 80% of those nearly 900 FDA approved medical AI devices that are out there. And that's because radiology uses a lot of data. Now, we know that 97% of healthcare data goes unused, and certainly a lot of radiology data goes unused, and no radiologist would be able to consume that amount of information through their optic nerves. But because we're exposed to AI, it can clearly benefit it from a diagnostic accuracy perspective, helping to personalize treatment and reduce some of those administrative tasks within the healthcare system. So from a radiology perspective, firstly, I suppose it'll allow for earlier detection of diseases, which is crucial for many conditions, particularly the likes of cancer. And these AI algorithms can just sift through vast amount of data, identifying patterns that may not be immediately or in fact ever be evident to clinicians. And ultimately these leads to more accurate and timely diagnosis, and they ultimately improve patient outcomes. And one of the key things about the environment we work in now is that there's three kind of steps. We've got data, decision making, and then outcomes. And everything we do as clinicians ultimately should be improving the outcomes. From a data perspective, we're now faced with an overwhelming amount of data that is there in terms of volume, but also in terms of the velocity that it's actually coming at us, as I've kind of referred to earlier on. The decisions process, which comes in the middle, is critical, and that decision process is under stress at the moment. It's under a lot of stress because people are overburdened with data. They're suffering from data fatigue, if not burnout. And really what we need is assistance, not replacement, but just assistance, or really a better word would be augmentation of making decisions, whereby it's human plus AI. And what we want then ultimately is for that to actually lead to an outcome that isn't worse, ideally is better than what was there before. So those are kind of the key things that we want to look at in our radiology space. And then because we've got this first mover advantage, it allows us to then pass the torch into the other fields within the healthcare system, which can equally benefit from it, but just not as early in the stage as radiology would. But as AI improves and is more widely adopted, it will ultimately play a significant role in personalizing treatment. And this will become down to the ability to evaluate multimodal silos of information that are pretty significant in terms of genomics, proteomics, metabolomics, electronic healthcare records, labs, the radiology, which obviously I've mentioned, and wearables and the environmental information that's all there. But all that information can now be, and certainly will be better, able to be gathered together with AI, generative AI, and probably quantum computing when it comes more mainstream, to allow us to tailor treatment plans to individual needs, enhancing efficacy. And actually a lot of stuff needs to move from healthcare 2.0, which is, break it and fix it, to actually healthcare 3.0, which Peter Attia refers to, where we need to prevent and keep people healthy in the first place. And areas that are more behind the office but are equally as important for us clinicians are those administrative tasks and the scheduling, and making sure people get the right test first, that they get a clear pathway through the healthcare system, whether that's in their home, whether it's in the community with their GP, or within the hospital environment. But there is a lot of burden on all healthcare professionals, be it clinical or non-clinical. So I think what this will do will also allow all of us to spend a bit more time, like Eric Topol would suggest with his great book, Deep Medicine, is that we can focus more time on the patient and have this high-tech, high-touch environment.
Because there is so much data, and you said 97%. Another way to look at that is we only use 3%, which is incredible. And unlike any other industry, healthcare data is unique to you. And ultimately, you need to have it. I remember, like 2 weeks ago, I went to an appointment with a specialist, and I got bloods done, and my doctor didn't pass on the bloods. So he was speaking to me on bloods from 6 months previously. And I felt like the whole visit was kind of redundant because it wasn't the latest bloods that we had. And purely because it's such a manual process, I felt like I had to go back and go through it again. And ideally, you would love your decision maker to have this unified version of the truth, this one source of truth that they can actually sync up and have access to, and you can have this kind of avatar as an extension of your doctor's experience and feel like you've got that precision medicine. And I really believe AI can take us on that journey. From a practical perspective, with some of the tools that you've used, have you seen any of your appointments go from, 50 minutes down to 40 minutes? Or have you seen any efficiencies come through that maybe you can see more patients than you did before because of the use of AIs in radiology?
Yeah, I'll give you one example that I've been privy to. I've the pleasure of being involved with Professor Ronan Colleen, who's the co-founder of xWave Technologies, and our CEO is Mitchell O'Gorman. xWave Technologies is a radiology company, but it's specifically a cloud-based AI-empowered point-of-care service for clinicians to act as a CDS, or clinical decision support tool. Part of the challenges within healthcare are twofold. One is 20 to 50% of studies that are ordered in radiology are actually the wrong test. So that means that patients get false reassurance, they get a delayed diagnosis, they need to come back for another test, or indeed you've got the environment being polluted by all these return trips. So that's the first challenge. The second one is scheduling. We know that when patients go to see their physician in the office, they go to order a radiology test like a CT, and the amount of time it takes for that order, which is sometimes paper-based, to get into the hands to be protocoled by a radiologist can be sometimes 10 days, 2 weeks, even longer, and the wait lists are kind of exacerbated, and you get confusion within the system, which leads to insecurity, which leads to sometimes maybe a double ordering. So to give you an example of xWave Technologies, which empowers the clinician to order the best test first, but also as fast as possible. Before it was introduced into the Royal Victoria Eye and Ear Hospital, where they do a lot of head and neck work and ophthalmology work, when a physician would order a test in the outpatient, it would typically take for the receiving radiologist in St. Vincent's public or private to actually protocol that, and for the patient to be notified, it would typically take about 10 working days. Whereas once we actually introduced this system, which was this point of care cloud-based smart scheduling system, it went down to from 7 working days, in fact, to 17 minutes. So in fact, actually, the patients were leaving the Royal Victoria Eye and Ear Hospital. They were in the car park, and they were now getting a phone call from the scheduling people. So that's kind of just a simple example of how you can not just twice improve the speed, but like exponentially improve outcomes and speed.
And you also mentioned a really good point was the administration part, because people like might forget, but it could be 4 or 5 people trying to make sure that people turn up on their appointments, cancellations, managing that. And so much is that people can't make the appointments, but they don't actually let the people know. So you can't actually get other people to actually fill into those slots. So there's a lot of kind of wasted times, which is actually very frustrating to all people. So if you can use text, WhatsApp, voice, or avatars making the calls or doing the emails, or having templates set up where you can automatically send out the response or attach records, almost like these kind of like personal assistants that augment the person working that job, you're going to have a lot more streamlined service as well. It's going to become really, really accessible, and then people can actually respond back in whatever way they want. Maybe that's WhatsApp, text, voice call, or note as well. And that doesn't mean people are going to be idle or stressed. What about like summarization of documents or research, or being able to use ChatGPT-esque to kind of look at a report and break it down to maybe 100-ish words or something like that? Have you been able to use it for these type of ways?
Absolutely. The end product of having a radiology exam is ultimately the radiologist report when all is said and done. And the report is going to be reported on by a human. And one thing that is guaranteed about humans is that we lack the same consistency. So I may report something tomorrow differently than I did today, but also my colleagues will report something different than I do. So we all have different styles. Some days we have good days, some days we have bad days. So when ultimately we do produce a report, the language we produce it in is sometimes Latin, and obviously healthcare, a lot of the language we use is based in Latin, and it's not user-friendly. And the audience is very, very varied. It ranges from an expert neurosurgeon to a junior house officer, to a general practitioner, to a patient who may be young, i.e. a child, middle-aged, are suffering with maybe early onset Alzheimer's disease, or indeed their family members. And we know that things get lost in translation. And what we really need to be able to do, and we can do it, I certainly do it on occasion myself. I've tried it, I'll copy and paste an anonymous report into the likes of ChatGPT and ask it to summarize it for a family member or for a 5-year-old child and tell a little story. And it's so powerful because then the actual data is converted into something that has true meaning for the end user. And ultimately, when people are informed, the facts are always friendly, as they say in life, whether you like it or not. Facts speak for themselves, and they allow you to make proper, informed decisions without having the emotions of maybe, I don't understand the report, or that sounds scary, or I wonder what they mean by that. And if you can communicate better with people, you will empower people with democratization of knowledge and facts, which ultimately lead them to make better decisions and their carers to make more nuanced decisions based on their part within the complex system of healthcare.
And kind of building on that, one of the ways that I've been using myself is when I came back, I got a DEXA scan and I met my rheumatologist and he gave me feedback on it. And I scanned it onto ChatGPT, and from sports surgery over to where I live, I talked to ChatGPT the whole way back about my T-scores, what they mean, what's good, what's not so good, ways to build it back up, exercise plan, explain it to me like a kind of medical profession. And that's what that person did, spoke to me in that regard. And for a lot of people, they're thinking, well, you put your medical data up on something that could be learned on. Now, I do have the paid version which says they don't train on your data. But either way, I made that decision because I felt that's what I needed. And the way it spoke to me with empathy allowed me to have the follow-up questions. I then later on, I took a picture of my hand. I said, I think this is swollen. Do you think it's broken? Again, it says, get expert advice, but it still said, it doesn't look broken. Here's telltale signs. And it talked me through moving it and putting ice on it. So I felt like I was having some type of relationship with that AI. Now, the only way I can explain that is when I do Google searches, I don't say please or thank you. But when I engage with ChatGPT, or the similar, I say please and thank you, and I feel like I'm in some type of relationship. And I'm very interested to see how doctors or yourself can start to use these models as an extension of your brand, your trusted brand, on that kind of precision medicine of your history, your information. Should you take the antibiotics? Should you not? Because rather than call you up at 6 o'clock, you've got this chatbot that can answer these questions for you based on your information. And this is where companies like Hippocratic AI have been kind of doing this in the States. I'm kind of interested, do you think that could be something that we could see here locally, and what that could play out like?
Oh, absolutely. I think as long as you are aware, and all of these technologies should be safely crawl, walked, run, and there are many challenges and they're multifaceted. As long as you look after the data privacy and security, look at ethical considerations and the regulatory aspects, I think clinicians can see this as a hugely powerful tool. From a clinician, but particularly a patient's perspective, you have to remember that these AI models they're 24/7. They never get tired. They never need to go to the toilet. They have endless knowledge, and the knowledge is just getting more and more accurate. As you know, ChatGPT 4.01, or Strawberry, came out last week. This has now got an accuracy that is significantly above 3.5, 4.0, and all of the other large language models out there. I think it's approaching the 80% level, which is really very significant. And this is just going to improve. So you then have this all-knowing chat bot that can be created either between the clinician and the AI model, or indeed with the patient to assist the patient. And you can feed in so much information, whether you want to talk to it, whether you want to give it a PDF, whether you want to have a video chat with it, download your endoscopy, download any other multimodal element of your healthcare system, and have it digest that, summarize it, and also look for the ability to be creative and consider rare diseases, because so many problems, and I include myself, I've got a complex chronic pain problem, and my clinicians that look after me haven't been able to figure it out. And I suspect I might be able to try and use the ChatGPTs of this world to try and help solve my complex medical needs. So I think with clinicians, I know that myself and many of my colleagues are already dipping their toe in the water and in an appropriate manner using these large language models securely to try it out. And what we are seeing is really incredibly powerful, incredibly impressive. And I think it's so important that we, as the most important people with the patient in the ecosystem, whereby we have often been the gatekeepers of knowledge, and we obviously want to see knowledge become more democratized, but we are the gatekeepers in terms of guiding the patient and what is ordered, what is reviewed, what is communicated. I think we need to improve our digital literacy, and particularly with AI, and be able to lean into it and see the art of the possible and try and stay ahead of the curve, because there will be many people coming to us looking for answers. Hospitals, the administrators, our junior colleagues, clearly patients, and the regulators and the makers of all of these AI models will be looking to clinicians for answers in terms of what is needed and how to deploy it. So it's really important that we all dip our toes into the water and lean into this exciting world, but also to be aware of the benefits, which are many. But like everything in life, whether it's fire, like fire obviously can keep you warm, but it can burn the house down. So that's the dual edge of AI, and we need to be aware of the risks. And as I mentioned earlier on, data privacy, security, GDPR, ethical considerations, and the whole regulatory aspect of AI, particularly now in the context of the EU AI Act, which has been implemented this year, and for many devices actually will come into effect probably in about 2 years' time. So it's really important that we try it out, learn about it, and have a very curious mindset and a very much a growth mindset, because we need to empower ourselves with knowledge to try and empower not only just the knowledge, but reduce the fear and distrust that is out there. And it's very much a normal thing to be not trusting of anything that's new. It's a normal human reaction, and some people have it more than others. So we, as the responsible people within the healthcare ecosystem, need to work as patient advocates and try and get ahead of things before things get ahead of us.
Yeah, and I think the trust comes from the openness to say, here's the pros, here's the cons. You need to opt into this or opt out, and these are some of the challenges with that. And for me, the more I read into it, I was open from that the data perspective, even if it was being trained. That's my value for me exceeded my potentially being data privacy concerns. You've also been wonderfully driving the conference that's been coming in Ireland and US. It's called the AIM Summit, and you've had some fantastic speakers at that sharing wonderful insights. And then you're going over with Martin Curley on Saturday to New York for the digital perspective. I think what's it called, the digital summit. Is that correct, John?
The Digital Health Symposium.
Digital Health Symposium, and that's in parallel with the UN Summit. And what's so exciting for me is you're getting these brilliant speakers to come in and talk about the art of the possible. Everyone's got difference of opinions, but they're here sharing, collaborating, and kind of removing those silos to start sharing those different types of insights. Give us an elevator pitch on the aims for Ireland and then the one for New York.
Yeah, so the American Irish Medical Summit also stands for Alliance, Innovation, Mentorship and Lessons from Sport. And what we do is annually in Ireland, we bring along people from both sides of the Atlantic, Americans and Irish, huge diaspora there, obviously. And Professor Peter Naughton and I, Professor Peter Naughton founded the AIM Summit, and he and I, along with Professor Rodriguez from Northwestern Memorial Hospital, are the co-chairs. And what we do is we bring clinicians from both sides of the Atlantic, along with the non-clinical people who may be in the health tech, med tech, biopharma space, but also very importantly, what we've done this year is we've got the big techs, we've got the Microsofts of this world, the NVIDIAs of this world. These are the people who are really laying down the foundations for healthcare and for all industries. So it's so important that we don't have conferences necessarily that are just scientifically based or technologically based or clinically based. We need to look at how the whole system works and bring all those silos together, which are really valuable in their own right, but incredibly valuable when you have a super convening place like AIMS, and that leads to super collider activity from an intellectual perspective, from a networking perspective, and it's nearly network-centric warfare on looking after the patients, which are at the center of everything we do. So it's a very exciting gathering every year, and we're bringing it to Chicago next St. Patrick's in March, and we'll be bringing it to where it all started, actually, which is Northwestern Memorial Hospital in Chicago next March in St. Patrick's Week.
That's brilliant. And hopefully in the run up to that, we can actually do a podcast, just talk about the speakers, the teams, what that could actually bring. So I'm guessing there's a lot of people in the US and Ireland that would like to attend that, have those collision points of conversation and bring people together to just discuss these things, because you're in healthcare for a reason. There's a lot of discretionary effort that goes into that.
We'll probably have one after next week because, as you mentioned, I'm traveling to New York this weekend, where Professor Martin Curley and I are having our 4th Digital Health Symposium aligned with the UN General Assembly Science Summit in New York each year in September. And this is based on the Solvay Conference of 1918, where the likes of Einstein, Marie Curie, Bohr brought together the brightest minds from around the world in physics and chemistry. So what we do every year is we invite 50 people from around the world, from all different countries and continents, people who are the best in the areas of digital transformation and innovation, bring them together in New York. The first 2 days are in Northwell Health, which is the largest healthcare provider in New York State, and in fact, the largest employer. And then the third day, we will have our AI for Good Health in Fordham University. And it's going to be a wonderful opportunity. But the key driver of this is to empower people to become more empowered with information, that healthcare is not something for the haves, but it's available to everybody, that it's more equitable, and also that we harness the data that is out there using evidence-based practice to ensure that we have people living longer, better, healthier, happier lives. So it's really a great opportunity for us to improve things at a global level.
Yeah, that's the thing about healthcare. We've all got skin in the game because we're impacted it throughout our lives, right? Through our family and our friends. So you don't get away from it. So it's very, very impactful. And I'm very, very optimistic, but I'm also realistic of the challenges to get there. But I believe AI is one of the most important tools to use, because the way things are going, we're not going to be able to do it without it. That's my kind of perspective. You look at the kind of the deficits that are going through. John Sheehan, thank you very much for taking your time and sharing some insights on the AI on podcast today.
Absolute pleasure, Mark. Look forward to catching up with you again.
On the 26th of November, join us for the 6th Annual AI Awards at the Marco Hotel in Dublin. This year's event promises to be our largest and most impressive yet, with over 300 community members in attendance and over 48 applications of AI in action. This truly is an incredible world-class event, and we are inviting you to this event. Experience the excitement live, because we're going to be capturing this with a world-class film crew, and it's going to be streamed online. However, if you want to join us in person, book your table now, because opportunities are limited. If you're interested in sponsoring this year's awards, please contact me at Mark@AI Awards for more information and see the best in class of AI applications on the island of Ireland.